I'm Haresh Mehta, Director of Cardiology SL Rise of Fortis Hospital and Consultant Interventional Cardiologist at PD Hinduja Hospital Khar and HN Reliance Hospital in Mumbai. The topic of today's discussion where I'm going to present is a special technique of stenting in bifurcation disease, which is called the double kiss crush. Now, the important topic that I'm going to discuss today in this one is that what are the challenges you can face when you do the DK crush and how to overcome these challenges. DK crush, as all of you all know, is a kind of bifurcation stent where we put one stent in the side branch, crush it with the main branch stent, do a kissing and get back again. So this involves lots of steps, needs lots of hardware and has to be precisely done. So in this technique, the side branch stent is placed and is crushed with a balloon. Once you crush this side branch stent with the balloon, you have to rewire this side branch and do a kissing inflation, which is the first kissing inflation. After that, you deploy the second stent in the main vessel, again recross both of them, do a kissing again and end with a pot. Now, why are we discussing this? The important point of discussing this is that when you select two stent strategy, which is DK crush, which is the best strategy of bifurcation stenting as the outcomes are the best in this, you have to have proper steps. Because if you miss the steps, you can lead to bad outcomes, which can lead to major adverse cardiovascular events, and that will make the procedure not good for the patient in the long run. So whenever we do a procedure in any such patient, we have to give them the best long-term outcome, not only the acute outcome. And the biggest challenges we face in these patients is that if you have inadequately crushed a stent, then crossing a wire may be difficult. Or if you have crushed a stent, your balloon crossing may be difficult. In these cases, there are tips and tricks which I'm going to discuss how to do that. And imaging forms an important tool in these patients to tell you that you've crossed the right strut of the wire to open the struts and to give a good result.